Good day, folks. Arun Sayal. I'm one of the faculty for the CASTED course. I want to thank you very much for signing up for one of our upcoming CASTED courses. In this little intro video, we're going to help you get the most out of the course. We're going to introduce you to 4 things you can do before the course, 4 things you can do at the course as well, that'll help you get the most out of the course. So, the course will change how you think about emerge orthopedics. If you just show up to the course, you attend the course, you'll be better afterwards. If you want to get the most out of it, just do these simple things that we're going to ask you to do. The first thing is the pre-course case review. So what you're going to do is just print off the PDF that's attached to the email. And when you have it, you'll click on the link to the video that runs through the 7 cases. Just imagine it was your last shift. Don't overthink it because you're a part of a course. You're not handing this in. This is just an exercise for you. We want you to look at the cases before you start reviewing any of the course material. Then at the end of the course, we'll show you the same 7 cases again. And you'll fill out the answers again. And if your answers have changed, then it's something you picked up during the course. You'll highlight to yourself how it's changed, and this will incentivize you to try to maintain that change. So this is just an exercise for you, but it's really valuable. It'll take about 25 or 30 minutes, depends how quickly you work through the cases. But again, don't overthink them. Second is a needs assessment. Just takes a couple of minutes, but you click on the link on the email, and what that'll take you to is our website. And then just tell us, select the course that you're in, registered for, and then just tell us what will help you most on your next shift. How does this help? Well, it helps us as faculty so we can tailor the course to what the needs are of the group. But on top of that, it helps you. Because if you say, you know what, I need a little help with kids' elbows, or, whatever happens, the acute knee injury, or how to reduce a distal radius fracture, whatever it happens to be, when we cover that part of the course, you'll go, oh, that was an area that I have some needs in, and then you'll pay a little more attention. The third thing is viewing a 65-minute principles video. After the course, we're actually going to change how you think about emerge orthopedics. We spend way too much time thinking about the x-ray, not enough time on the assessment. And when we make a diagnosis of a fracture, we sometimes don't understand what's a good versus a bad fracture. So we want to plant those seeds before you come to the course. During the course, we'll review those principles with you, and then you'll see case after case after case where those principles are highlighted. You'll see how they come to life, how they affect our decisions in the emergency department. And if you see that, then you'll understand the value of those principles, and that's really the foundational learning. We don't want you to memorize emerge ortho. We want you to understand it. And if you take that hour and just watch that video, you can do it in pieces, little bits at a time. And ideally, if you can, try to catch it a couple of times beforehand. And then you'll start to understand the principles more, because that's really the foundational piece of changing how you think about emerge orthopedics. And the fourth thing is you've got the manual and you've got some supplemental handouts, and you can flip through them. That's actually great, because then you'll see what's in there. You'll be familiar with the material. You'll be hearing it then multiple times when we talk about it during the course. But also, you'll know, hey, I should add that in. I want to put some extra notes in my own hand. And if you write some notes down while you're reviewing the stuff, while we're going through the cases, then it also helps it stick. So going through the manual, going through the supplemental handouts is really helpful. So those 4 things before the course: number 1, the pre-course cases; number 2, the needs assessment; number 3, the pre-course principles video; and number 4, just flipping through the manual and the supplemental handout. On the day of the course, what can you do that'll help you out? The most important thing really is to come well rested. We all work when we're tired. It's easy to push out when you're tired. It's hard to pull in. It's hard to learn things when we're tired. The end of day 1, we talk about kids' elbows, and those are pretty tricky. The end of day 2, we're going to change how you think about the acute knee injury exam and emerge, right? And if you're tired, it's hard to pull that stuff in. So again, come well rested, super important. Number 2, try to have a good sized monitor. This isn't something you should do off of an iPad. If you have a laptop, fine. If you have a secondary monitor, even better. We're going to show a lot of x-rays. There are some subtle signs of x-rays. And if you have a bigger monitor, it'll be a little easier to project. 3, try to have reliable Wi-Fi. The online course is, of course, over Zoom. And if there's an issue with the Wi-Fi, it can be a problem. So if you can just minimize any kind of bandwidth interference where you're at, that would be ideal. And the 4th thing is when you're actually going through the course, plan to manage the cases. We'll go through a lot of it. It's fairly interactive. A lot of the interaction is just by video where we ask you to show you one or two or with a show of hands. A lot of it's by polls. But even if we're not asking, you can play along as if you're like, okay, what would I do if I saw this on my next shift? How would I manage this? And the more active you are about playing a role in the care of that patient, the more you'll get out of it. So as faculty, again, myself, Greg, Matt, Bruce, we're really looking forward to meeting you on the days of the course. Any questions you have, please let us know beforehand. But it'll be a fun couple of days. It'll be interactive, and we're going to change how you think about emerge orthopedics. Again, the goal is to have you understand emerge ortho and not memorize it. I promise you the course will be practice changing. It'll be high yield. And as the science says behind, it's a ruthlessly clinical course. We're totally focused on what helps you on your next shift. So we're looking forward to meeting you in a few weeks, and I thank you very much for your attention. Have a great day.